We will see in this video about the femoral artery in detail and the anastomosis it participates with its neighboring arteries. So in a gross overview, the abdominal aorta will be dividing into common iliac arteries, and each common iliac artery is further divided into the external iliac artery and the internal iliac artery. The external iliac artery, which enters into the front of thigh beyond the inguinal ligament, is called as femoral artery, which continues as popliteal artery in the back of the leg. In other words, the femoral artery is the continuation of external iliac artery from the inguinal ligament onwards. So before we go into the topic, one need to know the difference between the mid-inguinal point and midpoint of inguinal ligament, which is very, very important. The mid-inguinal point is the point which is halfway between the pubic symphysis and the anterior superior iliac spine. This one. This is the pubic symphysis, anterior superior iliac spine. The midpoint is the mid-inguinal point where the pulsations of the femoral artery are felt, or femoral artery is at the mid-inguinal point. Coming to the midpoint of the inguinal ligament. You all know by now that inguinal ligament extends from anterior superior iliac spine to the pubic tubercle. So midpoint of the inguinal ligament is nothing but the halfway between the pubic tubercle and the anterior superior iliac spine, which is just the midpoint of the inguinal ligament. The midpoint of the inguinal ligament has the clinical importance of having the deep inguinal ring, which is located just above this point. So midpoint of the inguinal ligament is related to the deep inguinal ring, and mid-inguinal point is related to the femoral artery. So now the femoral artery, which is the chief artery of the lower limb, this one is the femoral artery. This is the femoral artery, which is cut here. As we have removed the superficial muscles, this is how the adductor magnus and brevis are exposed to show the osteoeponeurotic opening. So this is the femoral artery, which is in the front of the thigh, and that too in the femoral triangle, which is bounded laterally by the sartorius, medially by adductor longus, above by the inguinal ligament. And this is the femoral vein, and this is the femoral nerve with its branches. A big branch from the femoral artery, what you are seeing here, is the Profunda femoris artery. Now this chief artery of the lower limb, which is the femoral artery, is the continuation of the external iliac artery as it enters into the front of the thigh in the femoral triangle behind the inguinal ligament, corresponding to the mid-inguinal point within the femoral sheath. So this artery, it runs downwards and medially in the femoral triangle, and then it continues in the adductor canal, and at the lower end of the adductor canal, that is at the junction of upper 2/3 and lower 1/3 of the thigh, it leaves the front of the thigh through the adductor hiatus, this one, which is nothing but the fifth osteoeponeurotic opening in the adductor magnus, where this femoral artery, after passing through the adductor hiatus, it courses the back of the thigh and then continues as popliteal artery in the popliteal fossa. Okay, so this fifth osteoeponeurotic opening is nothing but an opening which is present in the adductor magnus. Likewise, there are 4 other osteoeponeurotic openings which are present, which give way for the perforators, the perforating arteries, which are the branches of the profunda femoris artery. We'll see to it later. So here you can very clearly see this is the inguinal ligament. Okay, this part is the pelvis, and this is what is the front of the thigh. So this is the external iliac artery along with the external iliac vein. This is the femoral nerve. So this external iliac artery at mid-inguinal point behind the inguinal ligament continues as femoral artery, which is present within the femoral triangle. Above it is bounded by the inguinal ligament, medially adductor longus, laterally by sartorius. And this is the 2/3, upper 2/3 and the lower 1/3 of the front of thigh, where it is passing through the adductor hiatus and courses behind the thigh, and in the popliteal fossa, which is a fossa behind the knee, as popliteal artery. Okay, so once we here it is the total, all the muscles of the thigh are present. This is the fascia lata. Once you remove the fascia lata, the muscles of the front of thigh are exposed. So here the sartorius is being cut to show the course of the femoral artery through the adductor hiatus. From here, this is the adductor canal, which is just beneath the sartorius is the adductor canal. Okay, so here even the rectus femoris is also cut to expose the branches of the profunda femoris. This is the profunda femoris artery, one of the largest branch of the femoral artery. Here you can see it is giving a branch, a bigger branch, just after it crosses the inguinal ligament entering into the thigh. It gives this branch the profunda femoris artery. This is the profunda femoris artery. The femoral artery is cut here to show clearly the other structures which are deeper to it. So this is the profunda femoris artery. These are the branches which are the perforating arteries, which we said are passing through the various osteoeponeurotic openings within the adductor magnus. And these are the branches of the profunda femoris, which we will see in detail now. Before we look into the branches and the course, we have to be very familiar with the femoral triangle. This is the adductor canal. This is the adductor hiatus, which will open to the back of the thigh, that is into the popliteal fossa. Now this femoral triangle is a triangular shaped structure, continues as a very narrow path, which is the adductor canal, both of which together it looks like a funnel shaped structure which opens into the adductor hiatus, and then it continues into an area which is called as popliteal fossa, which is a diamond shaped area just behind the knee joint. Okay, so we are concerned with the femoral triangle and the adductor canal. For the femoral artery, as the femoral artery exits from the front of the thigh via the adductor hiatus to the back of the thigh into the popliteal fossa, which is a diamond shaped structure, it is called as popliteal artery. So here the external iliac artery at the mid-inguinal point behind the inguinal ligament continues as femoral artery. As it passes through the adductor hiatus, okay, and then appears into the popliteal fossa behind, it continues as popliteal artery. This is the bigger branch, which is the Profunda femoris artery, and these are its various branches. Okay, so this gross overview of the front of the thigh, which has the femoral triangle which continues into the adductor canal, and that opens at the back of the thigh into the popliteal fossa. For you to know this overview is very important. Now let us see the relations of the femoral artery. So the relations of the femoral artery means its relations in the femoral triangle, because the femoral artery is present in the femoral triangle, then continues into the adductor canal, exits out of the adductor canal to the back of the thigh, the lower part of the thigh, and then into the popliteal fossa. So the relations of the femoral artery are in the femoral triangle and in the adductor canal. So now let us see the relations, the anterior relations of the femoral artery. So this picture depicts the superficial fascia. The skin is being removed, and this is what is the superficial fascia. The yellow thing what you are seeing is all fat, and these are all the cutaneous vessels, and these are all the nerves. Once the superficial fascia is removed, then you will be seeing the deep fascia, which is called as fascia lata. If you just go little beyond, that is deep, to the fascia lata, you will see these femoral vessels which are within the femoral sheath. Okay, so anteriorly, from superficial to deep, we have the skin, then it is the superficial fascia, then it is the deep fascia, and the anterior wall of the femoral sheath. So these are the layers that are present anteriorly. Now, what are the structures that are present anterior to the femoral artery? These greenish things are the lymph nodes, which are the horizontal and the vertical group of the inguinal group of lymph nodes, which are superficial, and then it is the superficial circumflex iliac vein, which is crossing the femoral artery here, that is related anteriorly. Okay, and then the genitofemoral nerve. This is the genitofemoral nerve. This is the femoral branch, and this is the genital branch, which goes to supply the genitals. And the femoral branch, it descends down behind the inguinal ligament into the femoral triangle to supply the skin over the femoral triangle. So this is the genitofemoral nerve, which is related. And then medial femoral cutaneous nerve and saphenous nerve. These are the branches of the femoral nerve. After you remove the fascia lata and expose the muscles, you will be able to see those two nerves, which I'll show you in a while. So a bit about this femoral sheath. It is a funnel-shaped extension of the fascia, which is the continuation of fascia transversalis anteriorly and fascia iliaca behind. This is fascia iliaca. So as these external iliac vessels, as they descend down into the front of the thigh, they pull these fascias on which they are resting also a bit into the femoral triangle. That's how the femoral sheath is being formed around the femoral vessels and not around the femoral nerve. So the femoral nerve is not included in the femoral sheath. So anteriorly, I repeat again, the femoral sheath is formed by extension of fascia transversalis anteriorly and fascia iliaca behind. This extends for about 3 to 4 centimeters below the inguinal ligament, and it gets blended with the tunica adventitia of the vessels. Okay, that is what is about the femoral sheath. So let us once again see what are the relations anteriorly. The anterior relations to the femoral artery are the skin, the superficial fascia, the deep fascia, which is the fascia lata, and the anterior wall of the femoral sheath. And the superficial group of the inguinal lymph nodes, the superficial circumflex iliac vein, and the genitofemoral nerve. The femoral branch of the genitofemoral nerve will be more appropriate. And then is the medial femoral cutaneous nerve and the saphenous nerve. So here the fascia lata is removed to expose the muscles of front of thigh and the structures. So this is what we have seen. This is a triangle, the femoral triangle. This is the sartorius, the adductor longus, the inguinal ligament, and the contents of the femoral triangle, which are the from lateral to the medial. It is the femoral nerve, femoral artery, femoral vein. So the other two structures what we were talking about are the medial femoral cutaneous nerve and the saphenous nerve, okay, which are the branches of anterior and posterior divisions of the femoral nerve. Okay, so the medial femoral cutaneous nerve and the saphenous nerve. In the femoral triangle, it is the medial femoral cutaneous nerve of the thigh is anterior to the femoral artery, and the saphenous nerve is anterior to the femoral artery in the adductor canal. So this is the sartorius which has been cut. So just behind the sartorius is the adductor canal, because the roof of the adductor canal is formed by sartorius. So here this is the adductor canal. So in the adductor canal, it is the saphenous nerve which is anterior, right? This is the dissected specimen. So this is the femoral vein. This is the great saphenous vein which is draining into the femoral vein. This is the femoral artery. This is the profunda femoris artery, right? This is the femoral nerve, the anterior division and the posterior divisions. Okay, and yeah, this is the saphenous nerve which is entering along with the femoral artery into as a content of the adductor canal, and you can see the femoral artery entering into the adductor hiatus, which is nothing but the fifth osteoeponeurotic opening in the adductor magnus, from where it courses in the back of the thigh and continues as popliteal artery behind. Okay, so this is what is the sartorius being cut. So you can see here the nerve fibers that are going to the sartorius. Okay, so this is the anterior division, which has two cutaneous nerves, which is the medial femoral cutaneous nerve and intermediate femoral cutaneous nerve. Okay, and this is the posterior division, which has the saphenous node, which is the only cutaneous nerve of the posterior division. Okay, this is the rectus femoris, this is the vastus medialis, vastus lateralis. If we cut open the rectus femoris, then you can see the vastus intermedius muscle, and this is what is adductor longus. Now let us see the posterior divisions. So this is the femoral artery, which is shown by lifting with a forceps. Medial to it is the femoral vein, and this is the femoral nerve, which is lateral. And this is what is the femoral triangle. Above is the inguinal ligament. This is sartorius laterally, adductor longus medially. So now when we see the floor of the femoral triangle here, after these things are being taken out, this is how the floor is seen. Okay, this is the iliacus muscle, this is the psoas major, this is the pectineus, and this is the adductor longus. So this forms the floor of the femoral triangle, right? So now the femoral artery is here resting on these structures, which happen to be the relations posterior. So the relations posteriorly from above downwards are, this is the inguinal ligament, and here is the pubic symphysis. This is the mid-inguinal point. So here is the femoral artery. What are they from above downwards? It is the psoas major muscle. It is the pectineus. So between the pectineus and the longus, there is this profunda femoris artery. So there is profunda femoris artery, which is just behind the femoral artery, which is separating the femoral artery from the pectineus muscle. That means the profunda femoris artery, this one, is between the pectineus and femoral artery. And behind there is this nerve to pectineus, which is also a branch from the femoral nerve trunk. Okay, so these things are present behind the femoral artery, resting on the pectineus muscle. Okay, so let me be more clear. The structures that are between the pectineus and the femoral artery are the profunda femoris artery and the nerve to pectineus, this yellow one here. Okay, and behind these two structures is the pectineus muscle, and then next is the adductor longus at the apex of the femoral triangle. And we said that this femoral vessels, that is the femoral artery and the femoral vein, are within the femoral sheath. So the posterior wall of the femoral sheath is also related to the femoral artery, which is nothing but the extension of fascia iliaca. So this is what is the femoral sheath, in which the femoral vessels are there, but the femoral nerve is excluded. Okay, after 3 to 4 centimeters, this femoral sheath, it gets blended with the tunica adventitia of these femoral vessels. So I repeat again, the posterior relations to the femoral artery from above downwards are the psoas major muscle, the pectineus, and the adductor longus. And the structures that are posterior to the femoral artery, which are between the artery and pectineus, are the profunda femoris artery and the nerve to pectineus, and the posterior wall of the femoral sheath. These are the structures that are related posteriorly to the artery. Now, how is this femoral vein that is related to the femoral artery? So, the femoral vein, it continues from the inguinal ligament as external iliac vein, right? So, this femoral vein is just medial to the femoral artery beyond the inguinal ligament. The femoral vein, it crosses to the lateral side being posterior to the artery, and at the apex of the femoral triangle, the femoral vein is directly behind the femoral artery, and this is the apex. Later on, this is the adductor canal. So, in the adductor canal, the femoral vein is lateral to the femoral artery. Is that clear? So, here in the femoral triangle, the femoral vein is medial to the femoral artery, and in the adductor canal, the femoral vein is lateral to the femoral artery. And at the apex of the femoral triangle, the femoral vein is directly behind the femoral artery. Is that clear? So, this is the femoral artery, and medial to that is the femoral vein, and this is what is the femoral nerve. So, we are not concerned with the nerve as such now. We are just talking about the relation of femoral artery to the femoral vein. We have said that femoral vein is medial in the femoral triangle and lateral in the adductor canal. So, let us put it this way about talking about the femoral artery, because we are talking about the femoral artery. So, the femoral artery in the femoral triangle is lateral to the femoral vein, and in the adductor canal, this is what is the adductor canal. Once the sartorius is removed, beneath the sartorius is the adductor canal. So, in the adductor canal, the femoral artery is medial to the femoral vein, and at the apex of the adductor canal, here the femoral vein is directly behind the femoral artery. So, you can put it in either way. You can write in relation to the vein, or talking that artery is medial to this and medial to the vein, or lateral to the vein. So, now let us see the relations of the femoral artery to the femoral nerve. So, this is the femoral nerve, which is lateral to the femoral artery within the femoral triangle, okay, and these are its branches. So, the femoral nerve, it is divided into anterior and posterior divisions, where the lateral circumflex femoral artery comes between the anterior and posterior divisions of the femoral nerve. So, in this diagrammatic representation, this is the trunk of the femoral nerve, the anterior division and the posterior division. So the anterior division has two cutaneous nerves and one muscular nerve, which is the nerve to sartorius. The two cutaneous nerves are the medial femoral cutaneous nerve and the intermediate femoral cutaneous nerve. And the posterior division has 5 branches, of which one is the cutaneous nerve, that is the saphenous nerve, and other 4 are the muscular branches to the quadriceps femoris muscles. The quadriceps muscles being the rectus femoris and 3 vasti, which are the vastus lateralis, vastus medialis. The one behind this rectus femoris is the vastus intermedius muscles. So those are the divisions, the branches from the posterior division. And from the trunk there are 2, that is nerve to iliacus, and this one is nerve to pectineus. So now let us see how these femoral nerve and its branches are related to the femoral artery in the femoral triangle as well as in the adductor canal. Right. Now in the femoral triangle, the trunk of the femoral nerve is related to the femoral artery laterally, and this femoral nerve is not included in the femoral sheath. As the nerve enters into the femoral triangle, it divides into 2 divisions, the anterior and the posterior divisions. Before that, from the trunk, it gives a branch which is nerve to pectineus, which is posterior to the femoral artery. Right? From the divisions, the anterior division, this one, there is this nerve which is called as medial femoral cutaneous nerve. So this medial femoral cutaneous nerve, it is initially lateral to the femoral artery. Then at the apex of the femoral triangle, this medial femoral cutaneous nerve, it crosses the femoral artery from lateral to the medial side. And then the saphenous nerve. The saphenous means superficial. So the saphenous nerve, which crosses the femoral artery from lateral to medial in the adductor canal. So even this saphenous nerve initially is lateral to the femoral artery. Here you can see. And in the adductor canal, it crosses the femoral artery from lateral to the medial side. And this long nerve, which is called as nerve to vastus medialis, this is the vastus medialis. So this nerve to vastus medialis is lateral to the femoral artery also, in the femoral triangle as well as in the adductor canal. Is that clear? So there are 4 nerves that are related to the femoral artery here in the front of the thigh, that is in the femoral triangle and in the adductor canal. From above downwards, let us see what are these nerves that are related. So in the femoral triangle, it is the nerve to pectineus, which is behind the femoral artery, and then at the apex of the femoral triangle, it is the medial femoral cutaneous nerve that is crossing the femoral artery from lateral to medial. Initially, the medial femoral cutaneous nerve is related lateral to the femoral artery in the triangle, and at the apex of the femoral triangle, it crosses from lateral to the medial side. Number 3, the third nerve is the saphenous nerve. In the femoral triangle, it is lateral, and in the adductor canal here, it crosses the femoral artery from lateral to medial side. Number 4 nerve is the nerve to vastus medialis. this is the vastus medialis muscle. Okay, so the nerve to vastus medialis is lateral to the femoral artery in the femoral triangle as well as in the adductor canal. So the other nerve is the genitofemoral nerve. To be more precise, I said it is the femoral branch of the genitofemoral nerve, which is also within the femoral sheath because it descends along with the femoral artery. So initially it is along with the femoral artery placed laterally, and as it enters into the femoral triangle, it appears anterior to the femoral artery, pierces the anterior wall of the femoral sheath, supplying the area over the femoral triangle. Now coming to the profunda femoris artery, which is one of the largest branches of the femoral artery, and it is between the femoral artery and the pectineus and is posterior to the femoral artery. And lower down, as you come down to towards the apex of the femoral triangle, the profunda femoris artery is separated from the femoral artery and the adductor longus. So in the upper part, the profunda femoris artery separates the femoral artery and the pectineus. That is, it is in between the pectineus posteriorly and the femoral artery anteriorly, and as it comes down in the lower part of the femoral triangle, it is between the adductor longus posteriorly and the femoral artery anteriorly. So this is what is the profunda femoris artery, the largest branch of the femoral artery. So clinically, the surgeons, they name the profunda femoris artery as deep femoral artery and the femoral artery as the superficial femoral artery, and before proximal to the profunda femoris artery, the proximal part of the femoral artery is called as common femoral artery. That is a clinical surgical nomenclature of this artery, just a thing to be known for you. Otherwise we will just restrict to the anatomical terms, that is the femoral artery. It gives a branch, the largest branch, which is called as profunda femoris artery. Profunda means deep. So an overview of the relations of the femoral artery. Anteriorly, it is the skin and the superficial fascia, and it is the sartorius also, which passes anteriorly, because just behind the sartorius only, or beneath the sartorius, is the adductor canal, within which the femoral artery is related to all these nerves, the saphenous nerve we said, and the just above the adductor canal at the apex of the femoral triangle, it is related to the medial femoral cutaneous nerve, and still more onto the base of the femoral triangle, nearer to the base of the femoral triangle, it is the femoral branch of the genitofemoral nerve, also is related anteriorly. And then posteriorly, it is resting on psoas major, then pectineus, then it is the adductor longus, and posteriorly there is nerve to pectineus, and there is profunda femoris artery as well. Medially, it is the femoral vein that is present along with its larger tributary, the great saphenous vein. And laterally, it is the femoral nerve with its branches, and all through its course, it is the nerve to vastus medialis, which is lateral to the femoral artery. And the artery, how does it terminate? It terminates passing through the adductor canal, and via the adductor hiatus, it exits the canal and enters into the popliteal fossa as popliteal artery. So the femoral artery, it continues as popliteal artery. So from above, when we take this continuation into consideration, it is the external iliac artery which continues as femoral artery admitting inguinal point behind the inguinal canal, and this femoral artery continues as popliteal artery in the popliteal fossa. Now coming to the branches of the femoral artery. So the femoral artery branches, we can divide it into the branches in the femoral triangle and branches in the adductor canal. To be more gross, before dividing the branches, when we just see the branches of the femoral artery, there are 3 superficial branches and 3 deep branches. And they are, the superficial branches are superficial epigastric artery, superficial external pudendal artery, superficial circumflex iliac artery. The deep branches are the profunda femoris artery, the deep external pudendal artery, the descending genicular artery, and the muscular branches. So there are 3 superficial branches and 4 deep branches of the femoral artery. I repeat again, the branches of femoral artery are 3 superficial and 4 deep. The superficial are superficial circumflex iliac artery, superficial epigastric artery, and superficial external pudendal artery. The deep branches are the deep external pudendal artery, the profunda femoris artery, the descending genicular artery, and the muscular branches. So now let us see each of these branch a bit in detail. So the superficial epigastric artery. So this superficial epigastric artery, it crosses the inguinal ligament, enters into the lower part of the abdomen below umbilicus, and it anastomosis with inferior epigastric artery branches. Okay, and then superficial external pudendal, it crosses the femoral vein and spermatic cord. It goes onto the medial aspect to supply the genital areas. And superficial circumflex iliac, it courses laterally along the inguinal ligament and joins with other branches to form spinous anastomosis. And coming to the deep branches, the deep external pudendal, it goes behind the spermatic cord. Superficial external pudendal is anterior to the spermatic cord, deep external pudendal is posterior to the spermatic cord. We'll see all these in detail, little bit in detail in a little while. And this is the profunda femoris artery, the largest branch, which gives the lateral circumflex, medial circumflex, and the perforating arteries, which all participate in various anastomosis, which are very, very important. Blood supply to the muscles of the thigh as well as the head and neck of the humerus as well. And then coming to the descending genicular artery, which gives a branch that participates in genicular anastomosis, that is the anastomosis around the knee joint. And most of these muscular branches, they supply the muscles in the thigh region. Yes, coming to the superficial epigastric artery. This is the superficial epigastric artery, this one. Okay, so now this arises just about 1 centimeter below the inguinal ligament from the femoral artery, and it passes through the femoral sheath. It pierces the femoral sheath and fascia cribrosa of the anterior abdominal wall and turns upwards in front of the inguinal ligament and goes medially till the umbilicus to supply the abdominal wall as far as the near the umbilicus, being between the two layers of superficial fascia of the anterior abdominal wall, and it supplies the superficial inguinal group of lymph nodes, the superficial fascia and the skin. And this anastomosis with the inferior epigastric artery branches and anastomosis with the superficial epigastric artery of the opposite side. Coming to the superficial circumflex iliac artery. This is the superficial circumflex iliac artery. So this is the smallest branch of the femoral artery, the superficial branches of the femoral artery, and it arises along very close to the superficial epigastric artery, and then it pierces the fascia lata and runs laterally parallel to the inguinal ligament till the anterior superior iliac spine. This is the anterior superior iliac spine, from where the inguinal ligament is attached to the pubic tubercle. So this courses along the inguinal ligament till the anterior superior iliac spine. Here it divides into branches to supply the integument of the groin region. This is the groin region, the fold between the trunk and the thigh is the groin. So it supplies the skin over the groin. It supplies the superficial fascia and also the superficial inguinal group of lymph nodes because they are here. And this superficial circumflex iliac artery, here in the diagram you can see, it is anastomosing. This is the superficial circumflex iliac artery. It anastomoses with the deep circumflex iliac artery, a branch from the superior gluteal artery, a branch from the lateral circumflex femoral artery, forming an anastomosis near the anterior superior iliac spine, which is called as spinous anastomosis. The spinous anastomosis can be your very short question. So the spinous anastomosis is formed at the anterior superior iliac spine, formed by the superficial circumflex iliac artery, which anastomoses with the deep circumflex iliac artery, a branch from the superior gluteal artery, and a ascending branch from the lateral circumflex femoral artery, and a branch from the iliolumbar artery. So these are the branches of internal iliac artery. So there is a communication between the internal iliac artery and the external iliac arteries branches. So that is what is spinous anastomosis. Coming to the superficial external pudendal artery. So this is the superficial external pudendal artery. This is the superficial epigastric artery. This is the superficial circumflex iliac artery. We have done these two. The other superficial branch, the third superficial branch, is the superficial external pudendal artery. So this superficial external pudendal artery is one of the three pudendal arteries, the other two being internal pudendal artery and deep external pudendal artery. So this arises from the femoral artery nearer to the superficial epigastric and superficial circumflex iliac arteries, and this, after piercing the femoral sheath and the fascia lata, it crosses medial side, medialwards, crosses anterior to, this is the spermatic cord, okay, this is the superficial inguinal ring, from which the spermatic cord enters into the scrotum, right? So this superficial external pudendal artery, it crosses in front or anterior to the spermatic cord in the males or in the round ligament in the females, and this artery supplies the integument of the lower part of the anterior abdominal wall. It supplies penis and scrotum of the males and labia majus in the females. And this superficial external pudendal artery, it anastomoses with the branches of internal pudendal artery by crossing the inguinal ligament. Okay, so here in this diagram also you can see this one which is going medially is the superficial external pudendal artery which goes in front of the spermatic cord. So to come out, it has to pierce the femoral sheath as well as the fascia lata. Right. Here this is the superficial external pudendal. Okay. This is the internal pudendal which gives the branches to the penis as dorsal artery of penis and the posterior scrotal arteries. So this external pudendal, superficial external pudendal anastomosis with posterior scrotal arteries, which are the branches of internal pudendal, which is the internal branch of the internal iliac. So here the superficial external pudendal is a branch of femoral artery, which is internal branch of the external iliac. So there is communication that is happening between the branches of internal iliac and the external iliac arteries here. Now coming to the profunda femoris artery. This one is the profunda femoris artery, right? So this is the largest branch of the femoral artery. It is a chief artery that is supplying all the three compartments of the thigh. So this arises from the lateral aspect of the femoral artery about 4 centimeters below the inguinal ligament, right? And this profunda femoris artery, it lies on the iliacus muscle and psoas major muscle. That is the reason it is posterior to the femoral artery, separating femoral artery from iliacus and psoas major muscles. Okay, and then it leaves the femoral artery passing deep to the adductor longus, that is at the apex, and it continues downwards. It first passes between the adductor longus and brevis, and then between longus and magnus in this area. I'll show you the diagram also. And then it ends as fifth perforating branch, the fourth perforating branch, which passes through the fourth osteoeponeurotic opening. Okay, so this is how the termination of the profunda femoris is happening. It terminates as fourth perforating artery, which participates, all these perforating arteries are the branches which participate in longitudinal arterial anastomosis. We will see to it in a little while. Okay, so to remember, it leaves the femoral triangle passing between the adductor longus and brevis, and then it is between adductor longus and adductor magnus, because brevis is still here only. Then it is the whole length is adductor longus. So here it is the brevis, In front of that is adductor longus here. So it is first between longus and brevis. As it comes down, it is between longus and magnus. So as I said, this is the diagram. This is the femoral artery. Okay, this is the profunda femoris artery. Okay, so this is the pectineus muscle. This is adductor longus, this is adductor brevis, and this is adductor magnus. So initially, the profunda femoris in the femoral triangle is between the pectineus and adductor longus, and then it is between the adductor longus and the adductor brevis posteriorly, and lower down it is between the adductor longus and adductor magnus, which is posterior. Here the profunda femoris is between, that is in the groove between the pectineus and adductor longus in the floor of the femoral triangle. So as it goes little deeper, it is having adductor longus anteriorly and adductor brevis. It is between these two. And little more lower down, that is lower to the femoral triangle, it is between the longus and the adductor magnus. This is what is the profunda femoris artery. So now this profunda femoris artery gives off the medial circumflex artery, the one which is going like this here, which is going posteriorly. This is the posterior aspect. So this is the medial circumflex femoral artery. This is the anterior aspect of the thigh region. So this is the lateral circumflex femoral artery. So it gives the medial circumflex femoral artery, the lateral circumflex femoral artery, and 1, 2, 3 and 4 perforating arteries. 1, 2, 3 are the branches of the profunda femoris artery, and this profunda femoris artery continues as 4th perforating artery. Okay, this is 1, 2, 3 and 4 perforating arteries. So here you can see this is 1, 2, 3 and 4. Perforating, that means they perforate, they pierce the adductor magnus muscle. There are few of these osteoeponeurotic openings within the adductor magnus at its insertion onto the linea aspera of the femur. It gives off these few small openings in the adductor magnus where these perforating arteries, they pierce the adductor magnus. Okay, so this is the medial circumflex femoral artery. It leaves the femoral triangle passing posteriorly between the pectineus and the psoas major muscles, and then this medial circumflex femoral artery is between the anterior and posterior divisions of obturator nerve, whereas lateral circumflex femoral artery, as we have seen, is between the anterior and posterior divisions of femoral nerve. So now coming to the lateral circumflex femoral artery. The lateral circumflex femoral artery, it is between the anterior and posterior divisions of the femoral nerve. It passes deep to the sartorius and rectus femoris, dividing into ascending, transverse and descending branches. Similarly, the medial circumflex also divides into ascending, transverse and descending branches. And these perforating branches, they are 4 in number. They perforate the adductor magnus and contribute to the supply of the muscles of the medial and posterior aspects of the thigh, and also in formation of longitudinal anastomosis. Right. Now coming to each branch, let us see a bit of it. the lateral circumflex femoral artery. This arises from the lateral aspect of the profunda femoris artery, and this is the largest branch. And this lateral circumflex femoral artery, this one, is seen between the divisions of the femoral nerve, that is between the anterior and posterior divisions of the femoral nerve. And then it passes laterally beneath the sartorius and divides into ascending branch, the transverse branch, and the descending branch. And then it winds round the neck of the femur. So the ascending branch, this one, this is the ascending branch. This is the lateral circumflex. This is the ascending branch. Yeah, this is the lateral circumflex. You can see we have cut the rectus femoris and the sartorius. This is the sartorius, this is the rectus femoris, to clearly visualize the branches of the profunda femoris. So this is the profunda femoris, the lateral circumflex. So as it passes beneath the sartorius here, it is dividing into ascending, transverse, and descending branches. So let us see the ascending branch now. So the ascending branch, this one, it passes upwards beneath the tensor fascia lata muscle. This one, this is the tensor fascia lata. This is the anterior superior iliac spine. We want this branch to go till here because it is participating in the spinous anastomosis. For it to go till here, it has to pass beneath the sartorius, beneath the rectus femoris, and beneath the fascia lata muscle, right, to the lateral aspect of the hip, and anastomosis with the terminal branches of the superior gluteal artery, the deep circumflex iliac artery, the superficial circumflex iliac artery, to form the spinous anastomosis. And it also contributes for the trochanteric anastomosis within the trochanteric fossa as well. So all these anastomosis, when we say anastomosis, it is a collateral circulation that is established and will become more prominent, circulating blood when there is blockage of the major arteries. Coming to the descending branch, this is the descending branch of the lateral circumflex femoral. This is the descending branch. You can see here, right? This is the descending branch. Okay. Now this descending branch, it runs downwards, okay, behind the rectus femoris, resting on vastus intermedius and along the vastus lateralis. This is the rectus femoris which is cut. Okay. So this is the descending branch of the lateral circumflex femoral artery. This one we are talking about. Okay. This one we are talking about. So as it descends down, it is behind the rectus femoris, resting on vastus intermedius and along the vastus lateralis. Okay. And then supplying all these muscles. As it descends down, it is accompanied by the nerve to vastus lateralis as well. As it descends down, you can see here, and it anastomoses with the superior lateral genicular artery, this one, participating in anastomosis around knee joint. Is that clear? It has a very important clinical feature. When we look into the cruciate anastomosis, we will see what the clinical feature is. So as of now, the descending branch, as it descends down, it is behind the rectus femoris muscle, resting over the vastus intermedius and along the vastus lateralis. Along with the nerve to vastus lateralis, it descends down, and then it participates anastomosing with the superior lateral genicular artery, contributing for genicular anastomosis, which is nothing but anastomosis around the knee joint. Now coming to the transverse branch. This is the transverse branch. Okay? Yes. So this transverse branch is the smallest branch of the lateral circumflex femoral artery. It winds round the neck of the femur anteriorly. This one you can see, this one. Okay? So it passes laterally over the vastus lateralis and then winding round. It pierces the vastus intermedius actually, and then winds round the neck of the femur just below the greater trochanter. This is the greater trochanter, this is the lesser trochanter. Anastomosing on the back of the thigh with the medial circumflex femoral artery, participating in cruciate anastomosis near the lesser trochanter behind. Okay, so the transverse branch, anastomosis with the transverse branch of the medial circumflex, along with the branch from the inferior gluteum above and the first perforator below, and forms the cruciate anastomosis nearer to the lesser trochanter behind, in the back of the thigh. That is called as cruciate anastomosis. So this transverse branch of the lateral circumflex femoral artery participates in cruciate anastomosis. This is the cadaveric dissection. You can see this is the femoral vein, this is the femoral artery, this is the profunda femoris artery, this is the femoral nerve with its divisions. So this is the posterior division, this is the anterior division. Okay, you can see the lateral circumflex artery between the anterior and posterior divisions of the femoral nerve. This is the ascending, this is the transverse, and this is the descending branches of the lateral circumflex femoral artery. Okay, here you can very clearly see this is the ascending branch going beneath the sartorius, which is cut here. This is the rectus femoris, which is cut, so it goes deep to the sartorius, rectus femoris, and then deep to the fascia lata muscle, and then goes till the anterior iliac spine to participate in the anastomosis. The transverse branch, it is also deep to sartorius, the rectus femoris, pierces the intermedius, and then winds round the neck of the femur to join with the transverse branch of the medial circumflex femoral artery participating in the anastomosis. So this is the descending branch, which is accompanied by the nerve to vastus lateralis, again behind the sartorius, behind the rectus femoris, resting on the vastus intermedius, along the vastus lateralis, descends down to participate in the anastomosis around the knee joint. Okay. Now coming to the medial circumflex femoral artery. This is the femoral artery, this is the profunda, this is the medial circumflex femoral artery, okay, which goes between the anterior and posterior divisions of obturator nerve. So this artery, it supplies the neck of the femur. Most of the blood supply to the neck of the femur is by the branches of the medial circumflex femoral artery. So any blockage or damage to the medial circumflex femoral artery, that is the fracture of neck of the femur, can lead to avascular necrosis of the neck of the femur, where it has to be replaced for proper functioning of the movements, the hip movements. So that forms a very important clinical feature with the medial circumflex femoral artery. So this medial circumflex femoral artery, it arises medial to the profunda femoris artery in the posterior aspect, and then it winds round the medial side of the femur and posterior to the neck of the femur. So as it passes first between the iliopsoas bow and the pectineus. That's how it passes. And then between the obturator externus and the adductor brevis. As it crosses the adductor brevis, it divides into superior, transverse and inferior branches. At the upper border of the adductor brevis. So the ascending branch, it participates in Trochanteric Anastomosis. The transverse branch, it participates in the Cruciate Anastomosis, and the descending branch, it participates in the Longitudinal Anastomosis. So you can see the descending branch, it descends beneath the adductor brevis, okay, to supply the adductor magnus. Anastomosing with the perforating arteries of the profunda femoris artery. And the transverse branch, it participates in the cruciate anastomosis. So let us see them. Both the lateral circumflex femoral artery and the medial circumflex femoral artery, as we said, they join each other, forming an extracapsular arterial circle. From this extracapsular arterial circle, both the lateral circumflex femoral artery and the medial circumflex femoral artery, they give radiating arteries which pass into the capsule of the hip joint to supply the head and neck of the femur, anastomosing with the acetabular branch of the obturator artery, which passes through the ligament of head of the femur. So from the ligament of head of the femur, here you can see the acetabular branch of the obturator artery, it enters inside the hip joint, and anastomosis with the retinacular branches or the radicular branches of both the lateral circumflex femoral artery and the medial circumflex femoral artery, which happens to be the main blood supply to the neck of the femur. So when there is any fracture of the neck of the femur, okay, there will be avascular necrosis of the head of the femur, which in case the head of the femur has to be replaced by prosthesis for the smooth functioning of the movements. Here you can see the retinacular arteries of both lateral and medial circumflex, how they are supplying the neck and head of the femur, and anastomosing with the acetabular branch, which enters via the ligament of head of the femur, okay, to anastomose with these circumflex branches and at the neck of the femur. So now let us see the branches in the adductor canal. the important one to be told about here is the descending genicular artery and few of the muscular branches. So this is the descending genicular artery, this one, which is going medial to the femur, medial to the knee joint, and medial side of the tibia. So this arises from the femoral artery just before the femoral artery passing through the adductor hiatus, which is the fifth osteoeponeurotic opening, from where the femoral artery, it courses onto the back of the thigh and into the popliteal fossa, continuing as popliteal artery. So just before the femoral artery entering into this adductor hiatus, it gives this branch, which is the descending genicular artery. And this immediately it divides into a saphenous branch and a musculoarticular branch, this one. So this saphenous branch, this pierces the eponeurotic opening of the adductor canal and accompanies the saphenous nerve to the medial side of the knee. It then passes between the sartorius and gracilis. And then this also pierces the fascia lata and is distributing to the integument here around the knee joint and the medial aspect of the upper part of the leg. As the saphenous branch descends down, you can see in this picture, this is the saphenous branch, it's coming down, and it is anastomosing with the medial inferior genicular artery, which contributes for the formation of the anastomosis around knee joint, which is called as genicular anastomosis. So the saphenous branch, it anastomoses with the inferior medial genicular artery. And now the musculoarticular branch. The musculoarticular branch, it descends down in the substance of vastus medialis and in front of the tendon of adductor magnus to the medial side of the knee. Here, this side, this is the articular branch, musculoarticular branch. So here this, at the knee, it anastomoses with the superior medial genicular artery, contributing for the formation of the genicular anastomosis. And this musculoarticular branch also gives a branch which passes above the patella, crossing the patellar tendon, joining, anastomosing with a branch from lateral superior genicular artery. All these supply the branches to the knee joint. So here, to be in short, the descending genicular artery, as it courses medially, divides into two branches, saphenous branch and musculoarticular branch. The saphenous branch descends down, articulating with the medial inferior genicular artery. The musculoarticular branch anastomoses with superior medial genicular artery and also with lateral superior genicular artery, contributing for the formation of the genicular anastomosis or the anastomosis around the knee joint, and the muscular branches to the surrounding muscles. Coming to the anastomosis, trochanteric anastomosis. This is the main anastomosis, which the branches of which it provides blood supply to the head of the femur, and this lies in the trochanteric fossa. This is the trochanteric fossa, just medial to the greater trochanter. This part is the trochanteric fossa. That is the reason the name is given as trochanteric anastomosis. And this trochanteric anastomosis provides a link of connection between the internal iliac and the external iliac arteries, which in turn is continued as femoral artery. Now, this anastomosis is formed by the descending branch of the superior gluteal and a branch from the inferior gluteal and the ascending branches of both lateral circumflex femoral and the medial circumflex femoral. All these they anastomose here in the trochanteric fossa to form trochanteric anastomosis. So this is the trochanteric anastomosis in this diagrammatic representation. You can see this is the common iliac, the external iliac continuing as femoral. This is the internal iliac. So from the internal iliac are the branches, the superior gluteal and the inferior gluteal. From the femoral, this is the profunda femoris artery, which is a largest branch. From the profunda femoris are the branches, the lateral and the medial circumflex femoral arteries. Now this trochanteric anastomosis is formed by the ascending branches of both lateral and medial circumflex femoral arteries, a descending branch from the superior gluteal and a branch from the inferior gluteal artery. So these branches from the anastomosis pass along the neck of the femur as reticular fibers along with the lenticular fibers of the capsule to supply the head and neck of the femur. So why is this trochanteric anastomosis important? As we have been saying that it is the main purpose to maintain blood supply to the head of the femur. In healthy people, most of the femoral head is supplied by medial circumflex femoral artery. But there is a contribution from the lateral circumflex femoral artery also. But if there is any occlusion to the medial femoral circumflex artery, the superior and the inferior gluteal arteries can compensate the supply to the head of the femur via the trochanteric anastomosis. Am I clear? I repeat again, the trochanteric anastomosis provides the connection between the internal iliac and external iliac arteries, and the trochanteric anastomosis is formed by the ascending branches of medial and lateral circumflex femoral arteries, a descending branch of the superior gluteal artery and a branch from inferior gluteal artery. Now let us see the cruciate anastomosis. This is the cruciate anastomosis. This also provides the connection between the internal iliac and the external iliac arteries. It is located at the level of lesser trochanter here. Here. This is the greater trochanter. This is the lesser trochanter. Here. Since this anastomosis is in a cruciform shape, that is a plus shape, the name is given so. So this is formed by the transverse branches of medial and lateral circumflex femoral arteries and the descending branch of the inferior gluteal artery and an ascending branch of the first perforating artery, of which the inferior gluteal artery is a branch from internal iliac artery, and the rest of the three branches, which are the branches of profunda femoris artery, in turn is a branch of the femoral artery, in turn is a continuation of external iliac artery. So that's how it is forming a connection between the external and internal iliac arteries. So here if we see in the diagrammatic representation, the cruciate anastomosis, the horizontal limb of the cruciate anastomosis is formed by the transverse branches of both the lateral and medial circumflex femoral arteries, and the vertical limb is formed by the descending branch of the inferior gluteal and the ascending branch of the first perforating artery. So why this cruciate anastomosis is important? If there is any blockage between the femoral artery and the external iliac artery here, so there is no flow lower down, that is through the profunda femoris and through the lateral and medial circumflex femoral arteries, isn't it? So how the blood to reach the popliteal artery to supply the lower limb? Now the route of the blood here, it flows via the internal iliac, then inferior gluteal, then the descending branch of the inferior gluteal, then the lateral circumflex femoral artery, then this is the lateral circumflex, isn't it? So this is the descending branch, ascending, and the transverse branch, and then it descends down via the descending branch of the lateral circumflex, and then as this is anastomosing with the superior lateral genicular artery, then via that it in turn is connected to the popliteal artery, because the superior lateral genicular artery is a branch from the popliteal artery. Is that clear? So I again repeat the route, the alternate route of the blood flow when there is a blockage between the external iliac artery and the femoral artery. Then the blood flows via the internal iliac artery, the inferior gluteal artery, the descending branch of the inferior gluteal artery, then the transverse branch of the lateral circumflex iliac artery, then the descending branch of the lateral circumflex iliac artery, then with the lateral superior genicular artery, then to the popliteal artery. So that's how the collateral circulation is maintained via this cruciate anastomosis. Now about the longitudinal arterial anastomosis at the back of the thigh. This is the longitudinal arterial anastomosis. This is the posterior aspect, this is the anterior aspect. So this is the femoral artery. Epigastric branch is the profunda femoris artery. These are 1, 2, 3 and 4 perforating arteries. They pierce the adductor magnus and then go over the back, dividing into ascending and descending arteries, which are anastomosing here. Okay, so this is all as the longitudinal arterial anastomosis. So this longitudinal anastomosis is close to the posterior aspect of the insertion of the adductor magnus along the linea aspera. Now as these perforating arteries, they perforate from the anterior aspect of the adductor magnus, appear on the posterior surface close to its insertion, they divide into ascending and descending arteries, and ascending and descending arteries continuously they anastomose with one another. So the first perforating artery, the ascending branch of the first perforating artery, it participates in the cruciate anastomosis, and the descending branch of the fourth perforating artery will anastomose with the superior muscular branch of the popliteal artery, thus having formed a continuous longitudinal anastomosis, which forms the main supply to the hamstring muscles. Now coming to the surface marking of the femoral artery. The surface marking of the femoral artery is done when the thigh is slightly flexed and abducted and laterally rotated, so that we see the anteromedial aspect of the thigh, in which a line is drawn from the mid-inguinal point to the adductor tubercle. Then the upper 2/3 of the imaginary line represents the femoral artery. The lower 1/3, it represents the popliteal artery. Okay, so this is what is the surface marking of the femoral artery. Coming to the clinical significance. So the femoral artery can be used for compression when there is bleeding beyond the inguinal ligament. The femoral artery can be compressed against the femoral head at the mid-inguinal point to control the bleeding of the distal limb. Palpation, that is to see the pulsations of the femoral artery, they are felt in the femoral triangle just below the mid-inguinal point. And cannulation. So this is how the cannulation can be done via the femoral artery, which is superficial in the femoral triangle. It is a preferred artery for the injecting dyes or sending any cannulas for angiography. So the cannula is inserted through the femoral artery via the external iliac, the common iliac, and then into the abdominal aorta, the thoracic aorta, the arch of aorta, and then into the heart. So from there it can even send through the coronary arteries for coronary angiography and angioplasty. And this femoral artery is also used for embalming purposes. When a dead body is received, the dead body has to be embalmed with formalin to preserve the tissues of the body to near normal. So the embalming is done via the femoral artery only, also along with the carotids at time here. So but right now, as we are concerned with femoral, the embalming is done using the femoral arteries. Yeah. This is the avascular necrosis of the head of the femur, which can be due to the fracture that can happen at the neck of the femur, where this arterial ring, which is formed by the medial and lateral circumflex femoral arteries, is injured, through which these retinacular branches, which enter into the capsule to supply the neck and head of the femur, they get compromised, causing the avascular necrosis of head of the femur, wherein the head of the femur has to be replaced by the prosthesis. That is called as the partial replacement of the hip joint. This is another important thing to be known as the blockages, the occlusion of the femoral artery and the successive branches of it in the lower limb. So this is how the normal flow will be there. If there is any plaque that is being formed, the blood flow will be decreased, and as and when the blood flow is decreased and when the plaque is increased, there won't be any blood flow to that region where the muscle here gets damaged. To overcome this aspect, a stent with balloon angioplasty will be sent and inflated at the plaque so that it increases the diameter of the blood vessel, and the stent is left in place and the balloon is withdrawn so that the diameter is maintained. This is one way of treating this obliterated arteries, occluded arteries. Another open procedure is that the saphenous vein is, you can see it here, they can take the part of the saphenous vein and the saphenous vein is reversed and is grafted above and below the blocked vein. It is reversed because you all know by now that the saphenous vein is full of the valves. So for the flow here from the artery to the artery, the valves should not be there. That is the reason the saphenous vein is reversed when it is bypassed here. So it is attached proximally and distally to the blocked vessel, as this great saphenous vein is very much accessible to the femoral artery in the leg. So this is the most preferred vein that is used for the graft here. And there is another feature which is called as pseudoaneurysm of the femoral artery. Aneurysm means it is the bulging of the walls of the femoral artery here, wherein all the walls they bulge in the aneurysm, whereas in pseudoaneurysm it is only the adventitia that is bulged. The media and intima do not extend into this bulge. So that is how it is represented. This is the groin region where you can see the bulge of the artery here, and it is little infected also here where there is a little bit of ooze. So this can be treated. Since all the walls of the artery are not involved in this bulge, it is called as pseudoaneurysm. Pseudo means false. So it's a false aneurysm. So this can be treated by compression under ultrasound, where this is done in few sittings, where this feeding tract for this pseudoaneurysm can be obliterated. That is one. Number two is thrombin is injected into it so that it will get clotted. Has to be very careful in doing this procedure. Always done under the ultrasound guided thing, wherein the stem, the track has to be literally very narrow to be done this. And another procedure is, after having the stent put in here, another catheter is being passed through which the whole of the pseudoaneurysm is filled with coils, so that there won't be blood that is entering into the pseudoaneurysm, and the aneurysm will not grow much further and will get absorbed and will get cut here. So these are the few procedures that are followed to treat the pseudoaneurysm. So have a good day, all of you. Thank you.